Very sorry, I turned it off. I am Park Jae-shin from KOICA. Welcome to the 2021 Pyeongchang Peace Forum, Day 3. UN SDG 3 on challenges and opportunities for SDG16 to enhance inclusive response and resilience against COVID-19. I'm very honored to moderate this session. Thank you very much for joining us despite your very busy schedules, our panelists, presenters, as well as our participants for joining in via online. Thank you very much for being here with us today. For more than 1 year, COVID-19 pandemic has been sweeping across the world. It is not only a health threat and crisis, it is also causing various difficulties in terms of economy as well as society. So the people's security as well as human rights are at risk. This crisis is especially felt severely by the vulnerable groups such as children, women, refugees, as well as people with disabilities. So the vulnerable groups' human rights as well as safety must be ensured in terms of formulating policies that are very inclusive and sustainable. Against this backdrop, for this forum, we're going to be taking a look at various difficulties and challenges regarding the implementation of SDGs 16 and then to hear insights and experiences from different organizations that are out there on the field to come up with the effective responses and resilience plans against COVID-19. I would like to now take a moment to introduce our presenters and panelists. Now from IDLO, International Development Law Organization, we have Dr. Ilaria Botigliero. Thank you very much. Due to her personal schedules, she won't be able to join us in real time. We will be sharing her pre-taped record. And the second presenter is Ms. Sonia Park from Namati, Director of Partnership Engagement at Namiti, who will talk about the importance and the roles of civic activists in response to the COVID-19 crisis. Third presenter is from KCOC, which is Korea NGO Council for Overseas Development Cooperation. Soo-kyung Yang will talk about various measures for promoting cooperation between domestic NGOs and KOICA in crisis response. And last but not least, we're going to invite Mr. Son Sung-il, who is a team leader for business strategy and planning at KOICA. He will talk about basic directions of KOICA in response to COVID-19 in implementing SDG 16. After all 4 presentations are shared, we're going to invite 2 panelists, Mr. Kim Dong-Joo from World Vision, and Ms. Jo Hee-kyung, who's from Child Fund Korea, for her views and opinions as well. Afterwards, from the Pyeongchang Forum website as well as from the YouTube channel, we will be receiving questions and comments from the online participants. Each presenter will be given 10 minutes to speak, and 2 panelists will be given about 5 to 7 minutes to share their views. All the presentations and discussions will be conducted in the Korean language. You can choose the language of your choice by clicking on the button at the bottom of your screen to listen to English interpretation. And if you have any questions, you can leave your questions on the platform, the Pyeongchang website platform, and we will try to relay those questions to our panelists as well as speakers. Now, I'm going to kick off the session by first inviting Dr. Ilaria Botigliero for her presentation.
Vice President, Director General of Strategy Planning, Director of Strategy and Policy Planning, distinguished panelists and colleagues. It is a distinct honor and a pleasure to be part of this panel today. Recognizing the rich history of the Pyeongchang Peace Forum, this year's theme on Peace New Deal, alongside the United Nations Agenda 2030 and the Sustainable Development Goals. My name is Ilaria Botigliero. I'm the Director of Research and Learning at IDLO. And together with IDLO's Director General, Ms. Jan Beagle, I warmly thank you for having invited IDLO to be part of this important conversation. IDLO is a global intergovernmental organization devoted exclusively to promoting the rule of law and advancing its contribution to peace building and sustainable development. 2020 has been an unusual year for all of us. The COVID-19 pandemic pushed us to innovate and adapt. It tested our collective resilience and challenged us to find new ways of working and new ways of reaching out to those most vulnerable and left behind in society: women and girls, children and youth, marginalized groups, the elderly, persons with disabilities, prisoners, among others. COVID-19 exposed social fragility and vulnerabilities like no other event. It exacerbated socioeconomic inequality, undermined development gains, rolled back achievements that had been made on the SDGs, and eroded public trust and confidence in institutions. Millions face food insecurity, loss of income, lack of social protection, shrinking space for civil society, and erosion of basic human rights, including a sharp rise in intimate partner violence and other forms of sexual and gender-based violence during lockdown. Building on over 30 years of practical experience in rule of law and access to justice, IDLO has acted quickly and redoubled its efforts to ensure justice and the rule of law enable an effective and equitable response to the pandemic and lead the way to a sustainable and inclusive recovery. To promote sustainable recovery, long-term responsiveness, resilience, and modernization of the justice sector, we have reoriented our work around 3 strategic priorities. These align well to KOICA ABC program on COVID-19 by targeting a response and resilience with a focus on fragility, capacity, and cooperation. Our first strategic priority is strengthening the legal and policy frameworks for managing COVID-19 response and recovery and preparing for future global health emergencies. The public health emergency has shown that the effectiveness of government measures to contain the virus, build resilience, and ensure a just, equitable, and sustainable recovery for all depends upon the capacity of public institutions and their leadership to provide transparent, effective, and accountable actions in line with rule of law principles. Through our field-based programs and operations, we have seen that rule of law-based responses can be powerful enablers of good governance, and they can help restore crucial precognitions for security, justice, and equality. Currently, we are collaborating with WHO and FAO to contribute specifically to crisis response and preparedness for future emergencies. In collaboration with WHO, we are working to strengthen domestic legal and policy frameworks on pandemic preparedness and response to public health emergencies. With FAO, we are working to mitigate adverse impacts of emergency laws and regulations on access to food, particularly for marginalized and vulnerable groups, women and girls. Experience has taught us that rule of law and access to justice cannot be put on hold during health emergencies. Justice systems have to remain accessible even during a pandemic, as their role becomes more, not less critical. For example, they serve to check and balance and constrain the misuse of emergency powers and the abuse of human rights, and provide protection for marginalized groups. Justice institutions also address corruption and provide access to remedies, which can literally spell the difference between life and death for those most at risk of COVID-19. Countries should continue adopting just and equitable legislative measures in line with state obligations to progress on economic, social, and cultural rights to support sustainable recovery and help build resiliency. These laws should include essential primary health care, access to quality testing, proven therapeutic medicines, and approved COVID-19 vaccines as global public goods. That said, it is also valuable to step back and look at a more holistic approach to sustainable recovery from COVID-19, one that addresses also interrelated challenges that cannot be tackled in isolation from one another. Despite the profound challenges it poses, the crisis also represents a unique opportunity to shift to greener, more resilient, more sustainable and inclusive societies. That is why at IDLO we have introduced climate justice as one of our key objectives in our new strategic plan. Our second strategic priority is mitigating the impact of the crisis on justice systems and justice seekers with a specific focus on those most vulnerable, women, girls, and marginalized groups, ensuring that no one is left behind. COVID-19 experience shows that public health measures and recovery efforts must be fully understood and supported before they can be successful. This requires citizens' participation in decisions related to their lives and health at local, national, and international levels. It is especially important that the perspectives and voices of women and marginalized groups are present in decision-making processes and integrated in the COVID-19 response. Because of physical distancing and other restrictions on movement, ensuring access to justice during the pandemic requires justice stakeholders to utilize information technology to allow remote access and virtual meetings. There is no doubt that technology and innovation can offer clear advantages in the context of SDG16, streamlining justice sector operations and improving the efficiency, timeliness, and transparency of justice. Ethical challenges, however, must be addressed to ensure fair and equitable access to technology and to mitigate the digital divide that risks leaving the most vulnerable groups behind. A few examples. In Kenya, IDLO supported the development and delivery of e-justice tools, including transcription programs, archive systems, and payment modules to ensure the continued provision of court services throughout the lockdown period. Also, to ensure that the most vulnerable receive full attention, we have doubled our efforts to enhance justice for women and girls. Extensive lockdowns, confinement and quarantine periods, combined with added strains of financial distress, have exceptionally increased domestic violence and, more broadly, gender-based violence. All this is well documented. Yet, in a recent rapid assessment of 30 countries, more than half have taken no action on gender-based violence. Our own IDLO research, conducted in partnership with UN Women, confirms that the COVID-19 pandemic presents significant threats to women's rights to health and to life. COVID-19 response must provide comprehensive access to social, psychosocial, economic, as well as legal services to survivors of gender-based violence. Finally, our third strategic priority is supporting and investing in a culture of justice to protect the rights and dignity of people everywhere and promoting a renewed spirit of multilateralism. COVID-19 has revealed how addressing pressing global challenges requires international cooperation, support, and solidarity. As part of the SDG16 community, it is clear that we must work collectively to tackle shared challenges, build resilience to common threats, and achieve the global goals. To be effective, COVID-19 recovery plans must integrate comprehensive good governance responses that extend beyond public health needs to respect, protect, and fulfill human rights. Soon after the onset of COVID-19, IDLO set up a crisis governance forum which recognizes that the road to health and well-being lies in good governance, strong public institutions, the rule of law, and access to justice. Because it was clear from the beginning that the pandemic would seriously disrupt economic, social, and political conditions. Multilateralism and the rule of law can appear as abstract concepts, perhaps distant from daily life, but they are both real and concrete, rooted in people's sense of solidarity equity, and equality. As such, they are really essential and critical to advancing peace and security, human dignity, and individual well-being. So I thank you for your kind attention, wishing you all a fruitful discussion and looking forward to meeting you in person next time. Goodbye.
Thank you, Dr. Ilaria Bottigliero.
She spoke about three strategic priorities that IDLO has presented in light of COVID response: strengthening legal and policy framework, and preparing for future global health emergency. And secondly is mitigating impacts of crisis on justice system and justice seekers, specifically focusing on those most vulnerable, especially women and girls and marginalized groups. And lastly, the third is to support and invest social justice that protects the rights of people everywhere under a renewed spirit of multilateralism. And these three strategic priorities of the IDLO will help us to recover better from COVID and ensure sustainable recovery. This is also in alignment with KOICA's ABC program. So thank you very much.
Now we're going to invite a second speaker who's from Namati, responsible for international cooperation. Sonia Park, how are you? Hello. So Sonia will talk about civic activists' role and importance in response to the pandemic crisis. Please start your presentation. Thank you very much. Hello. I'm working at an international civic organization called Namati. I'm Sonia Park. Our organization, Namati, is an organization that really looks at structural injustices as well as imbalances and how people that are affected by them can be empowered by seeking assistance from people around rather than trying to seek expert advice from the legal system that is so far removed from their reality. So it is all about legal empowerment of the citizens. We're trying to make sure that people really have a good understanding about this legal systems. Know law, use law, and shape law. These are the slogans that we're looking to promote, and we call that legal empowerment. And in order to realize the vision of legal empowerment, there are various activities that are currently being carried out around the world. Law systems as well as institutions have to function properly. And without them, as was mentioned by the previous speaker, people are very much affected by them, especially the socially vulnerable people. And the COVID-19 has so much highlighted the dangers of such issues, with various examples all around the world. When we talk about the pandemic, we look at the number of cases, as well as the deaths, as well as the number of beds, and the access to vaccines and therapeutics. So we're trying to deal with the crisis from a health point of view. But if you take a closer look, we need to understand that people are not evenly impacted by the crisis. As was mentioned by the previous speaker, not only in Korea, but also all around the world, whenever there's a crisis, people that actually lose their jobs are people who, for example, are in special employment or in irregular jobs. And also, there's a lot of risk in terms of domestic violence because of the lockdown measures. It is very difficult for these victims to access any justice system. And when there is, for example, an online administrative system that is replacing the offline system, it also affects unevenly those people that do not have any access to the internet connection. So we see various people that are falling victim to these issues. And even the air polluting power plants or those plants, concentrated areas, people that are living in those areas, and especially people of color, have actually a higher risk of dying from the COVID-19 pandemic. than people that are not. And these problems have been around us even before the COVID-19 pandemic, but the impact has been quite uneven. So our organization Namati, starting from last year, especially when we began to see the eruption of COVID-19 and with the lockdowns being enforced by various governments, we have this network that comprises 2,000 different organizations around the world, and we had conducted an emergency survey on them and how COVID-19 is impacting the justice system as well as the legal institutions, and what are some real life challenges to civic organizations that are working out there on the field. The survey, of course, highlighted the seriousness of the challenges at hand, but also in terms of the resources, innovation, and creativity, those were also being illustrated as well on the part of the CSOs. 50% of the respondents said that because it's difficult for them to meet people in person, they're very much constrained by various field-driven activities, but still they saw a lot of increases in terms of spending on transport, but the funding from the government has actually decreased. So there were various constraints that were confronting these organizations, but 90% of the respondents were saying that they were trying to change the way they were working in order to ensure continuity in their activities. And also any new problems that are emerging from the COVID-19 are actively being responded by the organizations. So there are so many CSOs out there who are working on their projects through a fund called COVID-19 Grassroots Justice Fund. This was set up last year, and KOICA was the early contributors to the fund. So December last year, only a few months ago, 20 countries around the world and 30 different CSOs have been identified to receive the fund from the Justice Fund. And one of the examples is involving Kenya Hockey Center. This is an organization that received the fund. Population is about 50 million, quite similar to that of Korea. And as much as 10% of the population, due to religious reasons or because of racial discrimination-related issues, they're unable to have access to the identity system. Usually, you would just go to a local center and submit your papers to receive your identity, but there are these people who are unable to access such system, and because they don't have any documentation to show, or they would have to go through a separate procedure to receive authentication or verification. So 5 million people or so are unable to register themselves in the identity system. You may think this is not really an important issue, but without an identity, you're actually treated as a stateless person, especially in terms of accessing public health as well as medical services and other type of administrative services. And in terms of testing and treatment, you're unable to access that as well. Also, sometimes these people are arrested on grounds that they were involved in some social gatherings that are actually being banned by the government. So they're very much exposed to these challenges and suspicions. So on the field, we're trying to make sure that there's a lot of advocacy activities to make sure that these people are given the rights to seek justice. And also, we have some emergency relief funds that are provided to those people in difficulties as well. I've only taken a couple of examples to show, but there are so many CSOs around the world who are trying to promote a democratic and just response in terms of COVID-19 actions, especially when we see these simultaneous crises that are taking place around the world. There are these socially vulnerable people who are unable to access this justice system. it is very important to work in collaboration with local community centers or hockey centers that are out there on the field who can provide a direct and relevant support for these vulnerable groups of people. And based on these experiences, at a policy level as well as a system level, we can make a more democratic and just response to COVID-19 and through advocacy activities. We are saying that there's a vaccine available out there, but in order to ensure access, equitable access to vaccine, it is really going to take a long time. And COVID-19 is also exacerbating inequities and inequalities across society, and those problems are not going to be easily resolved in a short period of time. So as such, those CSOs that are out there at the front line of democracy movement would have to play a bigger role going forward as well. This COVID-19 Grassroots Justice Fund that I mentioned before is going to evolve from a crisis fund to deal with other issues in terms of climate change, health, as well as women's rights and empowerment. For the legal empowerment activists, this fund is going to be evolved into a legal empowerment fund, and we're making preparations to bring that shift in the operation of the fund. Of course, the citizens were at the center of the democratic movement in Korea. And of course, the Korean government has shown a very strong administrative power in terms of responding to COVID-19, and that is setting a good example for other countries to follow. And Namati and the Legal Empowerment Funds and other organizations would like to make a lot of contributions in the process going forward. Thank you very much. Thank you, Dr. Park, Team Leader Park. You actually used up 10 minutes with 3 seconds left. Yes, thank you very much for keeping to the time constraint. Of course, COVID-19 has caused us a lot of problems, but then Namati conducted a survey to understand where that source of creativity and innovation lies in the CSO organization activities. You said that you drove a lot of changes in terms of the way you worked, and also KOICA, in order to respond to COVID-19, came up with the 3 major directions. First is business as usual. Our existing projects and programs were realigned and reinvented to better respond to COVID-19. And second, we took a look at different types of requirements in society. And ODA for health was strengthened to give better empowerment to people. And third is to turn this crisis into an opportunity. As a window of opportunity, what are some new initiatives that we can identify and work on? We understand that we went through a similar process last year to reinvent ourselves as well. And Namati and other CSOs, I understand, are confronting various difficulties, yet you're continuing on with your work and also taking a very innovative approach in implementing and strengthening your activities. Thank you very much, and I look forward to your good work as well, also as a citizen of Korea. Thank you.
Let me move on to the next speaker, who is from KCOC, Yang Soo-kyung, who's the Director of Fragile Context and Disaster Management Team. Hello. And Ms. Yang is going to be talking about local NGOs and overseas NGOs and cooperation with KOICA for a more effective response to the pandemic. Yes, I am going to share my screen with you here. I would like to talk about the ways where we can boost partnerships of Korean NGOs, local NGOs, and KOICA. The 2 speakers who just spoke ahead of me have all said as much. I would like to reiterate most of the points that they've made already. After COVID-19 began last year, it was such an unknown infection And we were all very confused at the time. We were able to really see firsthand how confusing those times were. And around the time the confusion started to die down somewhat, we were able to see other ways. We were able to see how vulnerable people were, because there were some people who did not know if they would die from COVID-19 or die of starvation. It has been 1 year since we've been living with COVID-19, but this is more than an infectious disease outbreak. This is a social, economic, and political crisis as well. Which is why in responding to COVID-19, it's very important for us to engage in an inclusive and an integrated recovery with governments, experts, CSOs, NGOs should all work together in that regard. And I think that we all share in that mindset. And we have to really prioritize the most vulnerable groups and vulnerable members of the population. And this is not just a short-term response, that we have to build resilience of the entire institutions and systems and try to protect and reinforce a more strong safety net for the population, especially for the marginalized members of the population. I think that we all share in that agreement, because otherwise the entire society is really shaking, its foundation is weakening, as we see. And so, based on SDG 16, we want to see how better, more effective we can be in pandemic response. In 2020, as we experienced the COVID-19 outbreak, I want to briefly tell you a little bit about how civil society responded to this outbreak. And based on the past experiences, I want to share with you what I think are important in the measures that we need to take going forward. The Korean civil society, as we underwent April and May last year, we made 2 appeals, both in April and May. And what we were saying was that COVID-19 is not just a local issue, that it is an international issue, and that we need to have a global response to the pandemic. Because if we just focus on local context only, then we can go the way of nationalism, and that is something that we wanted to beware of. And in May, we issued another appeal where we asked for about 660 billion Korean won to combat the virus with an NGO initiative. And we also stated our commitment that the NGOs would be the first in the field, and we urged governments and corporations and foundations to join in the action. These 2 appeals have been issued by us last year, and they are very important, and I think they're very relevant to the theme today, because it's here in blue. We really wanted to identify the most vulnerable, the most marginalized members of the population first. And we also wanted to work together with the local NGOs in the field in the most vulnerable countries and work together with those systems as well. So we wanted to be local specific and country specific. And we wanted to ensure the transparency and accountability through active communication. And we wanted to respond following internationally agreed humanitarian principles and human rights-based approach. And we wanted to secure special funding for humanitarian assistance and process of immediate support. And we wanted to consult closely with CSOs assisting developing countries to respond to COVID-19. After these appeals or these statements that we issued, we worked even harder in our response in the field. Because at the time, this was in April and May, we did not know a lot about COVID-19 infection. We wanted to understand better and know better to combat the virus. We wanted to understand better the situation in the different local contexts. We had many different webinars with health and medical experts. And we also receive some country reports on COVID-19 from different country managers. We also work together with Child Fund Korea. Child Fund Korea also has chapters across the world, and so we also receive some information from their chapters. And we also made use of KCOC radio to spread this information. And we also issued various articles and data sharing. This was the foundation for our response to COVID-19. We wanted to try to ensure a rapid and accurate and fact-based response to COVID-19, and this was very important for us. Many of the leading NGOs in Korea really worked very tirelessly in COVID-19 response. There are many represented here today: Good Neighbors, World Vision, Child Fund Korea, and Global Care, Africa Future Vision. Many of these different organizations worked very hard to build resilience against COVID-19. There are also more country responses, which I'm going to expand further later on, but I want to talk about the examples of Laos, Philippines, Cambodia, and Nepal. These countries provided some useful illustrations for us to better understand their response to COVID-19, and we also have good relationships with the local NGOs there. Many of the local NGOs really worked actively in carrying out joint response in the field. By working and collaborating with the NGOs, we feel that we can have a very effective pandemic response, and this is something that we've seen all over the world. Many countries are working very hard and preparing very hard against a pandemic response. In the case of the Philippines, the KOICA country office, a Korean NGO camp, and the local NGO called Zoto carried out joint response to COVID-19 for the poorest of the poor in Metro Manila in July for public health, awareness raising, and various local context-based activities. So here the key is that Korean NGOs, different chapters and country offices, especially KOICA, and the local NGOs in the field work together to carry out joint response. So going forward, we hope to build on this experience on how to be more cooperative in our response to this pandemic and future public health catastrophes. These NGO responses were possible because of the different strengths and the capacities of the NGOs, because they are operating off a humanitarian mission, and they have roots in the local community. They work very closely with the local community members, so they're grassroots organizations, which is a key advantage that NGOs have. And I think that we can build on these advantages of the NGOs, especially to do more outreach to the most marginalized members of the population in light of COVID-19, the people who are really powerless and who are not being protected. This sort of very intricate, very detailed outreach is very important, and this is something that only NGOs can do because they're working in the field, in the ground. So Korean NGOs and local NGOs can work together in joint response. And of the NGOs, there are some NGOs that have a lot of expertise, particularly in public health, in pandemic response, who are capable of rapid response. And these are the local NGOs that we really want to partner with. For more effective pandemic response, we have to build on these partnerships. And just briefly on what we can do to further our collaboration. I thought about 4 different categories. The first is funding priorities. The second is information sharing and clustering. Next, localization. Fourth, ecosystem. On funding, in 2020, to respond to COVID-19, KOICA and civil society partnership was set up for a 10 billion Korean won, a fund to work together with each other. And there was public-private program. There was a 2 billion Korean won that was implemented as part of this program as well. And I'm going to show you some of these categories here. So there is health service support for fragile countries, and build up the capacity to infectious disease response, particularly supporting the most vulnerable, women, children, and also to invest in these social enterprises in a social economy. And I think that this is also very relevant to SDGs 16. Based on this collaboration and this support, we want to go further to try to build a more robust and a bigger fund. Because of COVID-19, we're seeing socioeconomic crises come about. And I would like to propose a special fund in that regard. The government and KOICA, NGOs, and other organizations can work together to design a special fund. Because COVID-19 could be very prolonged and it could stay for a very long time in our society, and its aftermath can stay for a very long time. And even if COVID-19 goes away, there is the crisis of future pandemic outbreaks. So we have to have a special fund in place that is more long-term in nature. Through this special fund, we can help refugees, conflict regions, really focus on the more marginalized populations. And as mentioned before, we can also try to help eradicate domestic violence, gender-based violence, violence against children, which is also a big issue as we've just seen, but also go more than that to work towards a climate disaster reduction, environmental disaster reduction. This special fund can go a long way to help in that regard. So that is a proposal that I would like to make. Second is information sharing and clustering. I mentioned earlier that there are different country reports that we received. So there are people on the ground in different countries that collaborate with us. There's a COVID-19 information hub that KOICA built. This role is very important, and I think that this is something that other other countries can do. And this is not something that KOICA should do all on its own, but KOICA and other NGOs can work together on information sharing. This could be more systemic and be more concrete. And it would help if we can come up with a mapping system to identify geographically who is doing what where, and what kind of activities and programs are currently ongoing. And if we can share that very accurate information with one another, then we can better respond to COVID-19. And another idea is, I don't know a name for this yet, but Team K or something else along those lines. That the KOICA office, the government, NGOs, local NGOs, maybe one point person from each organization could come together in sort of a control tower organization, a control tower group that could assist in the operations of all of the stakeholders.
부장님, 죄송합니다. 시간 관계상
I'm very sorry, but I can only give you 1 minute. You will have to wrap up. So thirdly is localization. Localization is one of the key issues that was more exposed because of COVID-19, and this is something that we emphasized for a very long time, but we are not fully there yet. I think there is a big gap between organizations that was exacerbated by COVID-19. So I think that we have to build on the partnerships as well as individual programs. We have to move towards and focus on how to strengthen local capacity. And putting local NGOs and people in the center of project creation and management, and also in the center of advocacy to speak out for themselves for a social and medical system setting. So some are maybe partnerships, finding capacity, coordination, and complementary are the 6 core components of localization. Perhaps we can bring in local stakeholders early on in the field, or maybe make use of ICT, sort of allow for remote access. And lastly, on ecosystem, COVID-19 also really exposed the strengths of NGOs, but many NGOs are weakened, have been weakened because of COVID-19, and many NGOs are finding difficulty in funding. And there is a sort of a disparity among these NGOs. So for the sake of development cooperation, it's very important to have NGOs play a role to allow for security and operational security of these struggling NGOs would be key. So we would have to work together as a community to make that possible. In terms of development cooperation, it is very important for us to work together, especially in responding to COVID-19, that we have to work together. And through that, we can have a more effective response to COVID-19 and have a more expanded partnership in the future. Thank you. Thank you very much for your presentation, Ms. Yang. She talked about the appeal made by Korean NGOs in April, and I do remember that appeal, and that was submitted to the government, to the highest offices in the Blue House, and I remember that it received a good response. And so these NGOs and SCSOs have been working very tirelessly in the field to overcome a pandemic. So thank you very much. You did mention 4 things: funding, information sharing, localization, and ecosystem. So hopefully we can talk more about that later on in our discussion session.
여기 한국국제협력단
Yes, from the KOICA headquarters, a colleague who's working with me, Mr. Son Sung-il from KOICA, who's responsible for business strategy and planning. Hello. You will speak about KOICA's response and basic directions in regards to the implementation of SDG16. Hello, I am Son Sung-il, Business Strategy Planning Team Leader at KOICA. So when it comes to the implementation of SDG16, especially from the point of responding to COVID-19 and the directions that KOICA is currently taking, that would be the main topic of my presentation. I would like to share my presentation slides. Turning to the next page, table of contents, COVID ABC program of KOICA and SDG16, peace initiatives undertaken by KOICA, and strategic linkages between the 2 programs and the plans related to that. First, ABC programs of KOICA will be explained to you in detail. Since the outbreak of COVID-19 in April of last year, KOICA launched ABC program with urgency, and I will give you further details in the next slide. Basically, there are three major categories of the program, two different timelines. First, from the program point of view, actions on fragility. Second, building capacity. Third is comprehensive cooperation.
기간 측면에서는
Basically, 2021 is set as a short-term timeline, and 2022 and 2024 as long-term timeline for the implementation of the program. And there are different milestones for each of the time period, which will be explained in the next slide. So here's the ABC program in details. In the emergency stage, which is the year 2021, research for COVID-19 response and global citizenship alliance for crisis response have been identified as key tasks to undertake. And we're working on these right now. And from 2022 to 2024 period, resilience is very much emphasized. So from the point of research and development, there will be capacity building efforts, and also there will be connection and collaboration work, and also networking with global citizenship organizations, and also to diversify our activities in that regards. Next slide shows, together with the ABC program of KOICA, we have KOICA SDG16, Peace Governance, Midterm Plan, which was established recently. It's currently in implementation. The table shows the midterm plan, the second category here, focusing on governance aspects. This is 2.2, promoting public participation in decision-making process. This is where the program is tied in with the ABC program. This is based on participatory democracy in responding to COVID-19. And I'll give you more details in the next slide.
SDG 16번 전략에서 가지고 있는 이 참여적 민주주의 기반 COVID
So, participatory and democratic response to COVID-19 as part of SDG16 can be explained in two different aspects. First is providing better support for the local CSOs, and also to nurture and develop and train local NGOs. Second is the democratic media information sharing and capacity building for utilizing information. So, to summarize again, KOICA's ABC program, COVID-19 response program, and SDG16, peace governance, midterm implementation strategy, these two programs have common grounds. We're trying to provide a linkage, better linkage between the two programs at KOICA. I try to make it more visible or visualized. So local NGOs and capacity building are very much emphasized as part of the program. And also local NGOs, localization support, capacity building support are also stressed. And to carry out these programs, we're very much trying to strengthen the capacity of the NGOs by providing trainings, workshops, networking activities, and also identifying and exploring other relevant projects. Next slide, please. As I mentioned before, what we plan to do is as follows. With the outbreak of COVID-19 back in 2020, from the point of response, in order to revitalize the CSO network, inclusive COVID-19 response activities are being carried out. We try to strengthen cooperation and solidarity, and utilizing different online systems to provide better, more robust local support and assistance. And also from the point of resilience, we'll try to work on institutionalization of cooperation between the government and NGOs to strengthen resilience of local communities. and also providing better support and inclusive institutional related improvement activities for the vulnerable societies.
그 과정에서 코이카는
In that process,
언급된 바와 같이
as was explained before, together with Namati, Grassroots Justice Fund was set up in the amount of $100,000.
지난 12월에 그룹에 대한
As of December last year, 30 organizations were identified to receive the funds. So a detailed funding plan was developed. Next slide shows the identified programs, Argentina, Nigeria. Two case examples are shown here. As for Argentina,
정보
legal information related online system building is the program name, and Nigeria is related to people with disabilities, life-saving information. So it's providing life-saving information for people with disabilities.
코이카는 현재 이제 나마티와 함께
So KOICA is working in close cooperation with Namati in order to strengthen partnership with other CSOs around the world and carrying out our programs and activities. Last page is a summary.
코이카는
Our
정보
next
역량
steps.
강화와
We'll focus on capacity building for the government and CSOs through better systematic support. Inclusive institutionalization related capacity building will be carried out, and also based on local participation, platforms will be operated, and related activities will be disseminated so that resilience can be better built among citizens. Thank you very much. That concludes my presentation. Yes, team leader, Mr. Son, thank you for the presentation. So KOICA last year, 2020, launched a program called ABC with the development cooperation partners in their response to COVID-19 and also building back better. KOICA has been exploring various ways to promote better cooperation. And also at the same time, of course, we're dealing with an unprecedented COVID-19 crisis that's creating a lot of changes and disruptive changes in society, especially in terms of health as well as infection-related areas. It seems as if this big black hole is sucking everything into it. And that is why we had to focus and channel all our efforts on dealing with the health crisis. According to the plan, I think most activities are really much related to response, and of course, you would have to make more preparatory works to shift the program towards resilience, of course. There are other areas with equal importance, not just response. For example, climate action, rural community development, education and training. There has to be a balanced approach towards dealing with these different issues. And of course, it has to be linked back to the infections control, infectious disease control. A lot of efforts are especially needed in that regard. So thank you. We've heard from 3 presenters. Thank you very much. Very informative and insightful presentations indeed. And PPF website and YouTube channel will also receive questions from online participants. But before we open the floor, we'll listen to our 2 panelists, Mr. Kim Dong-Joo from World Vision, who is a team leader for international relief. We'll listen to Mr. Kim first. Thank you.
Yes, hello, my name is Kim Dong-Joo of World Vision. This is the worst human rights catastrophe since the Second World War. And it is difficult for us to achieve SDGs right now. In an effort for us to better implement SDG16, we have gathered here in this panel. So I'd like to thank everyone, especially KOICA. I think there are 2 things that I really want to stress. SDG16 has to, for democratic governance, try to identify the root of the cause of humanitarian crisis and try to have a structural response to the situation. KOICA and its collaboration with CSOs is very important because in light of the pandemic, we can really try to identify the vulnerable and marginalized groups especially the threats and risks to women and children and these vulnerable groups, to try to understand the social context, how these occur. And that is where we should identify the priorities of our activities. The guidelines and frameworks and the rules should be developed by organizations like KOICA. The pandemic is a global issue, but if we look at the most of the humanitarian issues, they are occurring in conflict regions and refugee settlements. And these people who have gone through conflict, they migrate, they move over different national borders. And in that regard, they are not becoming beneficiaries of different national policies and social policies because they're living in these temporary settlements near border regions. They have no choice but to live in these border camps. And many of them, their situation is becoming very prolonged. If we look at these specific characteristics of the border regions, these tend to be isolated from the official safety net or the official protection afforded by these governments of the countries. And it is also very limited in terms of other organizations trying to do outreach and using their tools to provide assistance to the refugees here. So instead of an official laws or official set of regulations, many of these border regions, particularly the refugee camps, are exposed to unofficial sets of laws and regulations. So in that regard, there are also it's very important to have a local context-based approach to these vulnerable members because they know better what's going on in the field and they're more grassroots-based. The legal empowerment is very important for these vulnerable members who are in crisis situations to have access to justice. So these social structural issues and these social structural systems have to be granted access. They have to provide access to these vulnerable members, and these guidelines and the frameworks should be developed to try to facilitate this kind of access. And they have to be properly applied to these vulnerable members and the CSOs that work with these vulnerable members. We have to try to help this go beyond being just simply good practices, but to become best practices. And through that, the SDG16 goal context can be better applied and better expanded. And this would be a very good learning experience for the CSOs and NGOs in the field. The ABC program by KOICA is a strategic program, and it's considerate of SDG16. And this can be tied in with the efforts of other NGOs and CSOs. As has been mentioned, the COVID-19 humanitarian support, many CSOs using funding and IT support are providing a new sort of more creative humanitarian assistance. Peace and human rights are some of the core items of SDG 16. If there were a checklist or a set of key guidelines, I think that would have been very helpful for CSOs and NGOs to use while working in the field. So that is the first thing that I wanted to say. And while we are seeing these new vulnerabilities come about, in responding to COVID-19, there are these secondary crises that are coming out of COVID-19, and NGOs and CSOs in responding to them. I think it's very important that their capacity becomes more systemized. As has been mentioned by the director of NAMATI, it's just practices has been mentioned. In a crisis or disaster situation, when there is a big risk to human life or to the environment, and this goes beyond the individual capacity to handle this, and there is actual insecurity, the vulnerability can be more aggravated. COVID-19 is a very complex disaster, and for this, the potential for the exacerbation of the different layers is very high. For example, there is inequity in the access to different government services or justice services, girls, people with disabilities, children, the elderly, they are being marginalized. And so this is really not in keeping with our foundations of justice. For KOICA, in the short term, they are trying to use existing projects and focusing on pandemic response and disaster relief. It's sort of a Korean model of humanitarian assistance that they are leveraging globally. But in the long term, we also have to look at social inequality or human rights protection, these secondary effects of COVID-19, particularly on the marginalized people. When they have no access to the local community, they mostly have only to rely on the care of the home. But what if there are children who are not under the care of their parents, for example? They are very vulnerable and exposed to risk. They need community care. So in that regard, grassroots organizations and local organizations have to provide that care. And I think that can provide expanded support to these children and to these groups. But under COVID-19, there's limits to our movement, and it's very difficult to do case management properly. And the individual capacity is being very downsized in that regard. And we're seeing urban poor or street children or domestic violence and gender-based violence that is really spilling out into the community. So this is not something that a single organization or different individual caseworkers can solve on their own. So this requires a systemic effort. World Vision is also working very hard to try to curb the expansion of these risks, to try to raise resilience and raise capacity and engage in multi-sector services and support to vulnerable groups, especially in our case, towards children. We are developing remote projects because of COVID-19 movement restrictions. And this, I think, is going to be a long term, these remote services. So that is also something we have to think about. Thank you very much, Mr. Kim Dong-Joo of World Vision. Last year, for a year, we've gone through an unprecedented crisis, a global pandemic, and we've been really trying to come up with an urgent response, a timely response to this, and I think that we've had a good learning experience, but for these experiences to really all become learned experience and that to become lessons learned, we have to really build on what we've learned and try to transition what we learn into best practices and then even transition that as new approaches and into new guidelines and a framework. KOICA will also try to exert our best efforts in that regard.
Last panelist I want to invite is Jo Hee-kyung, who's an Asian program manager from Child Fund Korea. Hello, can you hear me well? Can you begin your presentation? Yes, I am Jo Hee-kyung from Child Fund Korea. On the occasion of the Pyeongchang Peace Forum, the KOICA's session for UN SDG 2 session is currently being held, and I'm very happy to be part of this. We'll talk about the different measures and efforts being taken to increase the response capability and resilience against COVID-19 with various organizations here, and also to seek a common solution. I think human rights is a very important precondition when it comes to response to COVID-19 because these social and economic difficulties are having an uneven impact on these vulnerable groups, including women, children, as well as people with disabilities, migrants, and so forth. It is actually threatening their very survival. It is very important to empower these vulnerable groups of people through very inclusive policies. And our Child Fund Korea especially focused on the immediate impact on the vulnerable group, especially focusing on children and the relevant institutions surrounding the children. When it comes to quarantine, of course, it would mean to, for example, strengthen health-related services as well as institutions and systems, but it is also related to food security and also health-related capacity building, and also hygiene related to water resources, providing better support for the poor people. As was mentioned by the director from KOICA, the business as usual, which are to make sure that these people receive very basic services that are needed to maintain their daily lives. But we're taking a quite different approach in that we try to better understand and identify the needs of the people, but at the same time we focus on the human rights-based approach. In terms of the institutions and systems and services, what are the areas in which they have limited access to? What are these systematic issues that are actually making such vulnerabilities in the system? That is the key focus area of our programs. And also as part of the SDG16 related activities, because we're a children's fund, children's organization, befitting our mission, we want to make sure the children are protected and safeguarded as well as supported from any type of violence. Because they don't have a lot of access to public services, and also in terms of the burden and responsibilities for child care, they mostly reside within the boundaries of the home. So in terms of mental development, psychological development, there are threats related to that, also sexual violence against children, and the risk of that has actually increased as a result of COVID-19. The Western Africa saw the outbreak of Ebola. We saw early marriages of young children. We also saw an increased pregnancy among young girls as a result of the eruption of that disease. We also see similar problems in Korea as well. I'm very sorry, but we're having technical issues again. We weren't able to hear you well. What about other people? Do you have any issues in terms of listening? Perhaps it's, yes, maybe we've had our local connection issues here. Please continue on with your presentation. So anyway, we see increased instances in terms of violence against children. What I want to stress is that there's a need for education and training. And of course, you may think that COVID-19 is only related to education or health, but it's actually more than that. We have more children working in informal sectors. We also see a decreased birth rate as well. Also for women, the the surgeries that are operated on young girls, and we saw those different cases being taken. So there's this limited access to public services. We're trying to focus on those areas so that girls and those vulnerable groups are included in the part of that institutional justice. And the CSOs, of course, would have to work harder, and we have to work in close collaboration with these local communities as a local CSOs. And we want to be more flexible and nimble in responding to these crises, even during the lockdown periods. And of course, COVID-19 has caused various issues in terms of violence against children. And we also see an increased instances of violence against children in the online space. As children spend more time on the internet, those institutions and legal systems and arrangements are collapsing in the offline world. And it is actually becoming a transboundary issue, further exacerbating the situation. So children's safeguarding in the online space or sexual exploitation in the virtual world, those are the areas that we're focusing on in terms of responses. Of course, we had the nth room violence issue, as well as child exploitation and child abuse case recently that led to the death of a girl in Korea. So we see these very similar cases here, and some people may criticize that why don't we focus on local issues rather than just trying to look beyond our borders in rendering assistance. But it is really not so much about nationalist sentiment. It is really, we have to take a wider approach in terms of addressing this issue, and I really call upon other NGOs to come together as one. Well, the weakest chain. We have to always focus on strengthening the weakest chain of the system because this health system actually completely transformed and changed our daily lives. And this COVID-19 infection, which weakened systems in weak countries, it is actually affecting all the countries around the world. So we have to strengthen the weakest link in the system of the chain, and all these stakeholders, including the NGOs, have to come together in a better spirit of solidarity. Just health and medical related systems that we're undertaking in response to COVID-19, or food hygiene, as well as water security. Of course, they're critically important as well, but we really have to better protect those socially vulnerable people that are really not so seen in our activities. Thank you, and I will close with that comment. Thank you very much, Ms. Jo. Thank you for your comments. Of course, in our school system as well as in society, children, their education for children as well as childcare, of course, the services related to that have been provided by the institutions, but it's the burden of care has actually been imposed, or more a burden of care has been imposed on families as a result of COVID-19 lockdowns. Of course, we see increased number of cases in relation to violence against children in the online space, and sexual exploitation, child exploitation, and abuses cases being reported as well. And public sector has to work properly. And of course, we need to have a more important role to be played by CSOs because they're so relevant to local communities. Thank you very much. And we'll try to get questions from the Pyeongchang platform. And I'm going to designate these questions to the speakers. And each of the panelists or speakers will be given about 3 minutes to make their final comments as well as to make responses to the questions. I have a question to Sonia Park first. I believe that the topic at hand is very relevant. Of course, funding is a big issue, but funding has to be allocated to the right people. So it's the allocation issue is also critical. In a local country as well, due to various resources and communication, of course, there's a lot of people that are going very hungry at this point of time. So how can we better allocate these resources? And I have a question to Ms. Yang Soo-kyung.
To respond better to COVID-19, the government and civil society have to work very closely together, but CSOs also have to collaborate globally. Korean NGOs, have there been any success stories of them providing emergency assistance to foreign countries, and what role can the Korean government play? I'm very sorry, but I've been having a network error, some connection issues. I was not able to hear the question. Okay, so I'm sorry about the audio. This could just be my issue, but you cannot hear me very well. So why don't I text you? We'll have someone text you the question.
질문입니다. 코로나가 국내외 사회의 양극화를 더욱 악화시키고 있는데
There's a disparity that is growing in the society. What are you doing in terms of bridging these disparities?
후보자분들께도 질문이 들어와 있네요.
So I have questions to the panelists as well. To Jo Hee-kyung,
긴급한 상황에 따라
in an emergency situation,
SDG16 차원에서 대응하기 위한
in order to respond to SDG16,
SDG16 차원에서
in order to better respond to SDG16 implementation, what were some of the challenges that your organization experienced, not only in terms of the experiences, in terms of success, but also from failures as well? What are the lessons learned? And to Jo Hee-kyung, I have a question to you. So in this COVID-19 situation, what are some of the assistance and support measures for vulnerable children? What is the most effective measure for them? So we received these questions from the online participants. So I'm going to ask Sonia Park to respond to the question, perhaps to finish your comment in 3 minutes. Sonia Park? Thank you. I wasn't able to get the question and all, but of course I think you mentioned the importance of funding, but it has to be allocated and allotted to the right places at the right time. I think that was the gist of the question, how we can better respond to that question, right? If my understanding is correct, then yes. I think I mentioned this in my presentation, the COVID-19 Grassroots Justice Fund. This was not an effort that we took on our own. We worked with 3 different organizations in the relevant field through the form of a coalition to implement this fund. Fund for Global Human Rights is an organization that we work together with the other 2. It is to explore different type of CSOs around the world and to identify and allocate efficient resources to them. But not only this organization, also in the field of development. Of course, funding for NGOs really has a long history. There are a lot of organizations with a very long history as well as competence and capabilities. There are also funding-driven organizations. There are also issue-specific organizations that are working in different locations, providing good support for CSOs in those regions. So we created this network to work with other organizations, and I think such network of organizations will be a good means in allocating the resources.
네, 감사합니다.
Thank you very much.
이게 다각적인 다방면에 특화된 단체들의 협업으로
There are these collaboration.
말씀 주셨네요. 그다음 양수경 팀장님, 실장님, 네, 질문에
Thank you very much. We'd like to ask Ms. Yang for her response. The question was that collaboration between governments and CSOs is very important, but also collaboration across different CSOs. Yes, this is obviously very important. The CSOs and NGOs have to work very closely together. And the question also asks if there are any success cases of offering emergency assistance. Last year, the CSO Cooperation Office tried to promote a consortium, and this is something that was spearheaded by KOICA. And many organizations thought about different ways to engage in cooperation measures, and one of them was the Mekong consortium. So 3 organizations went to work together in the Mekong region to provide joint response to COVID-19. So this was a very successful story. Hat, World Vision, and another organization. I think these 3 organizations worked together. And I think that this consortium presented a good direction forward for organizations working together. So yes, organizations can also work individually, which is also important, but they can work in tandem. And they were offering customized activities. So they're working together, but also apart. And that was the consortium model. And what is the Korean government's role in this was part of the question as well. I think, as I mentioned before, it was KOICA who set the foundation for us to even begin this consortium. So KOICA provided this big framework for the CSOs to engage in this consortium, and that was a very big role that KOICA played. And that is why we would continue to urge the government to do something like that when they come up with this project framework to allow for wide-ranging collaboration from different NGOs, and that would be very helpful for us, for the government to lay this stepping stone, a sort of a framework for us, which is what KOICA did. And KOICA did not do this alone. When they came up with this framework, they worked very closely together with NGOs and communicated with NGOs to come up with this framework. So to engage in this constant communication on the part of KOICA with different NGOs has also been very instrumental in these efforts. That is all.
네, 감사합니다.
Yes, thank you very much. We often talk about CDC here: communication, cooperation, and collaboration. So the three C's that we have to engage in communication and collaboration and have that move forward towards more cooperation. So this is the foundation of our work.
우리 손성일 팀장님께서
Next to Mr. Son, could you respond to the question?
질문이 이제 코로나로
So the question was related to polarization due to COVID-19, the situation that is only getting worse, and whether there are any roles to be played by KOICA.
실은 뭐 양극화 이슈
So on the issue of social polarization or inequalities, of course, we looked at the vulnerable groups as well as marginalized groups in terms of SDG16 projects. KOICA as a whole is really much focused and dedicated on dealing with the vulnerable group issues.
파트너 국가들의 양극화
Especially, we've seen polarization issues only worsening in various partner organizations since COVID-19, and public service systems would have to be continuously strengthened. And at the same time, because polarization is only getting worse,
직접적인 타격을 받아서
and there are people who are directly hit by the COVID-19 crisis, and citizens and organizations that are in difficulties. We're trying to identify who they are so that we can provide them with custom-tailored support. The central region in Sri Lanka is a
잘 조성이 되어 있고
tourist destination. The travel industry, tourism industry is very big, and most of the income for the local community comes from tourism. But due to COVID-19, the local community economy is in difficulties. The citizens are really having a hard time there.
지역 한 2개 주 정도
So two different provinces over there were identified together with Habitat organization to build resilience of the local communities.
기본적으로 코로나 대응에 필요한
Basically, to respond to COVID-19, health, basic education
지역 개발 측면에서
programs, as well as local community development
적인 자립과 지원
and economic self-resilience and assistance were considered as important factors in planning for the program, and the program will begin from 2022. Another example is that we're working with other cooperations, taking a similar approach to focus our support on those hard-hit local communities.
마지막으로
Lastly,
저희가 이제 코로나 상황 이후에
once the COVID-19 situation has come under control,
이런 어떤
in terms of identification exploration of programs, there were, of course, the local issues to be considered due to logistics and transportation, and sometimes we have to seek support from international organizations
오늘 이야기 나온
in dealing with those issues.
시민사회
And as was mentioned before, we have these domestic Korean NGOs
맞춤형으로 현장에 같이 코이카와
who are really asked to work more closely with KOICA in responding to the needs of local communities. We really have to go beyond the current way of cooperation.
협의를 해
We really want to be actively engaged with local NGOs in better supporting our communities. Thank you very much, Mr. Son.
그 확대된 양극화를
So how to deal with polarization issues, inequalities? Of course, KOICA is taking its own initiative and also working together with other citizenship organizations, CSO organizations to respond better. Mr. Kim?
대응상에서 겪었던
In what were some of the challenges and success stories and some lessons learned from the challenges in responding to SDG16 and trying to implement SDG16? Can you restrict your comments to about 2 minutes, please?
네, 역시나 이제 코로나 이제 실질적으로 인도적 지원 현장에서 일하는 스태프들의 어떤
The staff working in the field, the humanitarian staff working in the field, that was one of the issues that we encountered to try to protect the safety of the workers in the field. So in a COVID-19 pandemic, we had
코이카 인도적 지원
people working as part of the KOICA in humanitarian assistance relief to provide assistance to Rohingya Muslim refugees in the field.
현장에서 그 사업을
And in engaging in these projects, some of our workers actually became infected by COVID-19 virus. And in some of the refugee camps,
어떤 정부의 제약이나
there were many restrictions getting in, and there are these guidelines and social distancing rules restricting the movement and restricting the number of people who could be together in the same room.
정해진 기간 안에 사업비를 이제
But because we had to execute and implement our budget within the time frame that had been stipulated, it was very difficult to try to have these effects. These humanitarian assistance needs continue to evolve. So, for example, for these women that we had to help, there were these women's shelters, and we wanted to provide education on raising awareness on gender equality and etc. We had set up a center and we had set up a shelter, but because of COVID-19, we had to change around our approach. Instead of having people come into the shelter and come into the center, we had to do remote outreach instead. We wanted to try to keep our vision and mission intact, but we had to change around our operation and change around our approach because of the pandemic. And so we had to be very flexible in adapting to these changes in our project to try to do a better contextual analysis. And that was something that we were able to do as part of a project that we did. And I did mention this in my remarks, but we want to do conflict prevention and peace building. This is something that SDGs and WHO also say this, but in all levels, the engagement and participation are so important. World Vision also understands the importance of child protection. We internally feel that there is not many of these capacity building exercises, and we hope to build on some of these weaknesses to try to expand on them and have that apply to our projects. And what I want to say is that there are these policy issues surrounding different projects. We want to tie them in with advocacy efforts and allow for more citizen engagement and citizen participation, because those opportunities are very important. Yes, thank you very much, Mr. Kim Dong-Joo. We are 3 minutes past schedule, but we have one last speaker remaining. So with your understanding, we'd like to hear from her remarks and then conclude the session.
어린이재단 팀장님.
And Ms. Choi Kyung from Child Fund Korea, especially targeted support for children from vulnerable groups of society, vulnerable families. Can you respond to that? Of course, COVID-19 has caused a lot of problems on one hand, but also brought a lot of opportunities, especially because of online opportunities are really out there. So people in these neglected communities could actually have better opportunities by connecting to the online system. The UNGA, as well as government-related organizations, the meetings engaged children from all around the world to listen to their voice. We had a lot of opportunities for listening to the voices of children. And in the process of decision-making, and we, for example, had the engagement of the children. And of course, we want to have a better engagement with children going forward. I think that's going to be very important. And of course, we have to take a long-term approach, not just a short-term approach in improving the systems. We have to give a better enabling environment to build resilience in local communities and their families and their institutions, and legal systems would have to be improved so that it could have a better long-term effects. Thank you very much. I will end with that comment. Thank you, Joe, for your comment. So from the forum today, looked at the various ways in which we should seek changes in our project implementation, better respond to the post-COVID-19 era. Also, there was an emphasis on partnership, strengthening partnership for the implementation of SDG16 by working very collaboratively with the local CSOs. We all understood the importance of a local partnership.
우리 기관들과의 네트워크를
We also need to continue to strengthen and utilize a network with CSOs working dedicatedly for achieving SDGs 16, and I hope that we will be able to explore better opportunities of collaboration with these organizations, and KOICA promises that. So this session was on challenges and opportunities for SDG 16 to enhance inclusive response and resilience against COVID-19. We will conclude the session here. We would like to thank the organizer as well as our online participants and speakers and panelists. Thank you very much for your efforts. Thank you. Have a good day.